Diabetes Connections is brought to you by the only ultra-rapid-acting inhaled insulin, by Omnipod, simplify life with Omnipod 5, by Dexcom G7, the most accurate CGM system, and by EdgePark, simplify your diabetes journey with EdgePark.
This is Diabetes Connections with Stacey Sims.
This week, most of us wouldn't think twice about using someone else's emergency glucagon if our child or another adult needed it. But that's something a school nurse or other healthcare provider could lose their license over. Now, some states are passing legislation to make it easier for anyone to use anyone's rescue glucagon.
Everybody's going to be for this bill. Even if you don't agree with politically the person that represents you, it doesn't matter. This is about a child's life.
That's Rep.DougStoner, who lives with type 1. She and her husband, Georgia State Representative DougStoner, joined me this week to talk about what they were able to get passed in their state, what you can do to take action in yours, and what else they're planning to help people with diabetes. This podcast is not intended as medical advice. If you have those kinds of questions, please contact your healthcare provider. Welcome to another week of the show. I am always so glad to have you here. You know we aim to educate and inspire about diabetes with a focus on people who use insulin. I've been doing this podcast since 2015, and I've seen a lot of changes in the podcast industry over that time, not just in diabetes technology, right, but in podcasting as well. And I just wanted to take a quick moment to let you know that we are now on YouTube Music. Yeah, this has been a pretty wild year for podcasting. Stitcher went away completely. I don't think anybody was really listening to the show on Stitcher anymore, but that is gone as of the end of August of 2023. No more Stitcher. But YouTube Music now lets podcasters load our shows there. I knew this was coming. It was available in a very limited way to people who put their podcasts on YouTube, and I've been doing that for a long time as well. But big thanks to listener Eric, who emailed me to ask if I could make sure to put Diabetes Connections on YouTube Music, because he said it was the only show he was still using Google Podcasts for, and he wanted to get rid of that app. Are you using Google Podcasts? This was one of those that everybody thought was going to be amazing for Android and was really going to kill Apple Podcasts. And I don't know, Google just doesn't seem to have put the time in on it or anything. So Eric wanted me to be on YouTube Music. I hadn't gotten a notification that I was eligible, but it took me 5 minutes to put the show on there. So if that's where you want to listen, go right ahead. All the shows are there. It might lag a little bit behind, a little more inside baseball. And I promise I'll get to the interview. But I set almost every episode to go live at 4 a.m. on the day it drops. That's every Tuesday for the regular episodes and every other Friday for the In the News episodes. I do that because in the olden days, it took several hours for it to populate everywhere. And I wanted to make sure people could wake up and have the show. And the habit has stuck with me. I like doing it that way. As of right now, there is one extra step to get the episode to YouTube Music, and I can't do it until the episode is live. I'm sure that'll change, but for right now, there's probably going to be a little bit of a lag, and those episodes will be out later in the morning on the days that they go live. So thanks again, Eric, for pointing this out. And if you're not sure, if you always listen through diabetes-connections.com, or you're new to the show and you don't want to use the podcast app where you're listening, on the website, on diabetes-connections.com, if you scroll down toward the middle, we've got a bunch of links to where else you can go. And for Android users, there's also a link. It'll take you to all your options for Android. I think it even takes you to what you already have on your phone. It's a really handy link I found a few years back. So all of that to say, let me know where you want to listen to the show, because I want to be everywhere I can be to make it easy for you to get the information that you want. Okay, let's talk about glucagon. A couple of years ago, you may remember this story. A school nurse in Illinois had a student with type 1 diabetes lose consciousness in her office. She went to grab the emergency glucagon and realized the only one she had belonged to another student. She used it anyway. Everybody was fine. But the nurse was really concerned because she could lose her license for doing like this. It's a huge liability for the school district because she was taking a prescription item, right, prescribed for one person, using it for someone for whom it was not prescribed. Of course, everybody was okay with this. Both families, the student who was unconscious and the student whose glucagon was used, they both said, come on, this is fine. The nurse talked to her state rep in Illinois, and he filed legislation allowing schools to just buy glucagon and keep it on hand for anybody who needed it. Similar bills have passed now in 3 other states, including Georgia, which went into effect this past July 1st. To explain what went into that bill and what you can do if you'd like to take this up with your state legislators, I'm talking this week to, full disclosure, two people who are friends of mine, Trip and DougStoner. Doug is a member of the Georgia House of Representatives. He is in District 40 there. Trip was diagnosed as an adult during her first pregnancy. They thought it was gestational diabetes, and then she'll tell the story. It was, of course, type 1 diabetes. She and Doug have been on the show before. I'm going to link up our previous episodes because we do allude to them. And then one more bit of housekeeping. I've known Trip for a very long time, back in the blogging days of the diabetes online community, 2008, 2009. I've always called her Trip. It's not her real name, not a surprise. Her name is Della. So Doug calls her Della during the interview, and I call her Trip. We didn't even realize it until we were all done. And I listened back, and we are going back and forth on that. So Della, Trip, same person. We also mention a bunch of links. I will put them in the show notes so you don't have to write anything down while you're listening. And that's up next. Well, it used to be that you would have to choose between an automated insulin delivery system and the freedom of a tubeless device. Well, now with Omnipod 5, you can have the best of both worlds, all in one. Omnipod 5 adapts with every pod change to meet your unique insulin needs and adjusts insulin using a customized target glucose, not a range. If you're ready to ditch the multiple daily injections or send your tubed pump packing, there's never been a better time. They'll even check your insurance coverage for you. Fill out the quick online form, see if you're eligible for a free trial. Go to diabetes-connections.com and click on the Omnipod logo. For full safety risk information and free trial terms and conditions, visit omnipod.com/diabetesconnections. Doug and Trip, welcome back to Diabetes Connections. It's always great to talk to the two of you. Thanks for coming on.
Thanks for having us, Stacey.
Thank you, Stacey. Glad to be here.
Let's jump in and talk about what this is all about, because I was surprised to find out this is even an issue. Doug, let me start with you. What is the problem that you were trying to solve here around glucagon?
The issue is, all states have different laws as it relates to prescription medication and who that prescription medication is, in a sense, prescribed for, other ones who gets to take it, and for good reasons. There was good reasons why these laws were made, obviously, because you're not supposed to be sharing your prescription medication with someone else, and it's absolutely illegal. And anyone doing that, also, be they a doctor or be they a nurse or someone who takes prescribed medication and give it to someone who is not the patient that medicine was prescribed for, could eventually lose their license in most states. In fact, I think every state you could lose your license. So the issue simply was glucagon is a prescribed medication. And we were having situations where children, particularly younger children who are type 1 diabetics, are going to school, and kids have a tendency to lose things. We all know that, including their prescription medication. And there have been several episodes around the country where a child has lost their glucagon prescribed medication, and the school doesn't have a backup. They're in a situation where you're not going to get emergency services there in time. And suddenly you've put a nurse, particularly a school nurse, in a situation where if another child has glucagon, and it's all the same, if they take that child's glucagon and give it to another child to hopefully save their life in a hypoglycemic episode, they could lose their license under law. And so obviously that's not our intention. Someone have to second guess themselves about, should I take on the liability or not? And that's really what it was. Is, the reasons we have those laws, there's good reasons we have those laws, but this was creating some serious issues in the sense of these circumstances that do occur occasionally.
I'm thinking about when Benny was in elementary school, and it's not only that he might lose something, which that kid lost everything, but I would forget sometimes to replenish, right? So things can expire, or you're in a different part of the school or something like that. So tell me, what is actually in the bill? Like, what does it say now in Georgia?
Well, what the bill specifically states is that public and private schools, K through 12, are now being given the authority. It's not a mandate, just it allows them to do this, to stock what's called undesignated ready-to-use glucagon. So this is the premix, auto-injector type. And so it authorizes them to be able to stock it and give it to someone who it is not prescribed. That's why it's called unprescribed. So they can give it in emergency situations. And it also authorizes doctors to write unprescribed glucagon prescriptions, in a sense, for a school system or for a particular school. And also it authorizes the pharmacies to actually fill out those prescriptions that are, again, not prescribed to an individual, but to an institution provided for emergency uses. So now in Georgia, as of July 1st, that's when this law went into effect, any school, be they public or private, K through 12, is now allowed to stock unprescribed glucagon auto injectors, ready to use glucagon. And they can give them to really any person, but specifically, obviously, children who are having a severe hypoglycemic episode.
Chip, I wanted you to join us too, because you live with type 1, and I think your perspective is really valuable on this. I'm curious, have you ever had to use glucagon?
I am very fortunate that I have not, but it is something, especially when you're dealing with children who often don't recognize symptoms of low blood sugar, sometimes and can't articulate that they're experiencing that. So their chances of using glucagon, I feel, are a little bit higher than an adult with type 1, to be honest with you, is how I feel about it. One thing I wanted to add to Doug is that what this bill basically does is it treats glucagon just as an EpiPen or Narcan, which most states already have a law that makes Narcan and EpiPens, and there's one or two other little drugs like that, as unprescribed, and allows school systems and also like ambulance drivers to carry that and use it as unprescribed.
I almost hesitate to ask it this way, but in the real life living with type 1, I think of, again, my family's experience where there were 4 other kids in elementary school, and we all as parents kind of said, do you need this? If you ran out of this, can you use that? And we had this like unspoken agreement that it wasn't really supposed to be done, but that we would share. Trip, that's how we live with this, right?
Even today, I recently had an experience where my drugstore couldn't get my insulin in time. I literally ran out of insulin. It was actually easier for me to go to a friend who lives a lot closer than my endocrinologist to get a sample. And I, quote unquote, borrowed a vial until mine came in and I could give it back. It's just the way the disease is. Arrest me if I give somebody a life-saving drug, go for it. I'm going to do what I've got to do for anybody with this condition that, is in that situation.
Doug, when you talk about this with your fellow representatives and you explain it, I wonder what the reaction is, because to hear Trip talk about it like that, and I've done that as well. I've certainly given pump supplies, and I've met people at gas stations, and here's some insulin for you. When you kind of talk about it in those terms, what's their reaction?
Well, generally, because we have to talk to people, first of all, they don't know what glucagon is.
Yeah, that's a great point.
They have an understanding, very basic, rudimentary understanding of type 1 diabetes. The point being is that you have to kind of do that background. So the way we kind of explain it too, because almost everybody understands what an EpiPen is for and how that works. What we do is you kind of start there and say, okay, glucagon is basically the EpiPen for type 1 diabetics. And when you start there, they go like, okay, I already understand the context you're trying to explain. And then we talk about, if you have very low glucose and a severe hyperglycemic episode, what does that mean? And what that can do to, predominantly a child, everything from, the worst case scenario, death, to brain damage and other things that could happen if you don't have this medication available. Ultimately, a child could die.
You also have to talk about the timing of this. This is not a drug that can wait. When you're in need of it, you're in need of it then and then. 5 minutes is not an option.
Right. And this in particular, I had this conversation with the rural legislators specifically. Access to an ambulance who stocks glucagon, right, on that ambulance may not be there in time because you have, more limited ambulance service in these rural communities. And you have rural counties in Georgia, and Georgia's not unique here, who may not have any ambulance service. In other words, no one's coming to save you in that sense. So as Della's saying that the time factor too, that this, when you need it, and you need it now, was the other factor explaining this to legislators. And luckily, there are several legislators who have children. Some of them are adults now. Representative Danny Mathis, who worked with me on this bill too, he has a 41-year-old son who's a type 1 diabetic, and he's from rural Georgia. He got it immediately. He understood it. So, it was just explain to them how, in a way, this is the EpiPen as it relates to this type of medical situation. And this was, life-saving medication. And on top of that, why would we want to put any of our school nurses or other school personnel who've been trained, because, some schools don't have school nurses, but people are trained on this, how to provide this. Why would we want to put them in any type of legal liability or danger to make them think twice about providing this medication?
You may have already said this. I apologize. Does this cover all forms of glucagon? There's Gvoke, which is the injectable. There's the nasal spray, Baqsimi. Does it cover all of those? Right back to our conversation. But first, I know you have a lot of questions about Afrezza. Every time I mention it, the emails and the DMs come in. So what is it all about? Well, Afrezza is an ultra-rapid-acting mealtime insulin. You breathe it in using an oral inhaler. Afrezza gives you the flexibility to eat when you want while providing proven blood sugar control. Afrezza's ultra-rapid action allows you to inhale your insulin right when food arrives, even unexpectedly. So you can be spontaneous but still in control without the need for injections at mealtime. Find out more, see if Afrezza is right for you. Go to diabetes-connections.com and click on the Afrezza logo. Afrezza can cause serious side effects, including sudden lung problems and low potassium. It is not for patients with chronic lung disease such as asthma or COPD, or for patients allergic to insulin. Tell your doctor if you've ever smoked, have ever had kidney or liver problems, history of lung cancer, or if you're pregnant or breastfeeding. Most common side effects are low blood sugar, cough, and sore throat. Severe low blood sugar can be fatal. Do not replace long-acting insulin with Afrezza. Afrezza is not for use to treat diabetic ketoacidosis. Please see full prescribing information, including boxed warning, medication guide, and instructions for use on Afrezza.com/safety. Now back to my conversation with Trip and Doug, and we are talking about what kinds of glucagon are covered here.
Well, what the reference is, it's called ready-to-use glucagon. So we're not specific in the sense of an auto-injector. It can be other forms that are, in a sense, pre-mixed, versus the older type of glucagon kit that you would have, where you would have to sit there and try to mix it and all that, which are, something that when you deal with the medical folks and even the school nurses, they still think of it in that way.
Right.
And so we had to do a little education with the school nurses too, by the way. So, no. We're talking about auto injectors, inhalers, other types that, where everything's premixed. All you're doing is, it's like an EpiPen or something like that. You're just, you don't have to think about it, I guess is the way to put it.
It's funny too, Trip, to think about how new that stuff is, right?
Oh, yeah.
I mean, it's 5 years old at the most?
Maybe at the most. I mean, one of the reasons why we did it that way is there are some ambulance service people that we had talked to, and they said their people had trouble mixing the old kind of glucagon where you have to mix it. And in that situation, I mean, it's a scary situation. I mean, I cannot imagine being in somebody's shoes and you're trying to mix something. You've got a relationship with this person. I mean, nerves kick in. I mean, I don't care how well trained you are. When you're talking about a loved one, it's quite different than, a stranger on the street that you're trying to do this for. It was mainly to keep it simple for the school personnel, the school nurse, the school teacher that was given this and said, "Oh, you'll probably never need to use this," and all of a sudden they have to.
Yeah.
I would much rather it be as simple for them as possible than saying, "Okay, you got to do this, and you got to take this air, you got to insert this into the powder, you got to swirl this up, then you got to redraw it back out." I mean, the steps are unbelievable. I mean, while they're doable, it would be better if it was just pre-mixed for everybody.
I love to tell the story that back in the day, a lot of conferences would have a session where you could refresh yourself on how to use the old red box and orange box glucagon kits. And the last one I went to, I was sure I was doing everything correctly. And then they said, "Oh no, at the very end, I was holding the needle incorrectly. I had my thumb, I didn't even think about it. I had my thumb on the back. Like I could have depressed it while I was pressing it in and not given enough. You have to hold it like a dart," I was told. I was like, how am I supposed to remember this if my son is unconscious? So it used to panic me because I figured there's no way I'm going to keep a calm and cool head in a panic situation. So I'm with you. I'm so glad it's different now. If people aren't sure if this is in their state, because I'm assuming this is just the beginning, it's in a couple of states, as you had mentioned right at the beginning, Doug, what can they do to check and then to try to do something about it?
Well, and that's a good point. So as of this moment, only 4 states have actually changed the law. Currently, it's Illinois, Ohio, obviously now Georgia, and I believe it's Kentucky, if I'm trying to remember correctly. So those are we're the now the 4th state to do this, and Illinois started this. So there definitely there's different websites in the sense you can go to. The main thing is several of the manufacturers are providing websites of states that allow this and don't allow this. The ready to use glucagon folks. Because obviously, with all due respect, it's in their interest to provide this information out there.
I've got a quick way you can check. Yeah, call your pharmacy and ask, can they fill an unprescribed glucagon prescription?
Oh, interesting. Sure.
That's really the quickest and easiest way other than a Google search.
Got it. So what can we do if we're in a state that doesn't have this? What's the process for doing something like this? If somebody's never called their state rep, they have no idea. Where do you start? How do you do it?
I would start with going to openstates.com, put in your address, and it's going to list all of your elected officials down to your dog catcher. From there, you can contact your state representative and your state senator. Those are 2 different positions from your federal level Congress people. Ask for a quick meeting with them. Explain, that this is basically just like EpiPens and that it needs to be included in the unprescribed medicine for school systems. It's really a no-brainer to these legislators. You've already got several examples of this law. You're more than welcome to look up Georgia's law. It's 2023 House Bill 440. You could take
I can link that up too. Yeah.
Yeah, you can take a copy straight to them and say, we just want to be able to save lives. As divided as most political systems are today, this is one of those in the middle ground, like pieces of legislation that is a no-brainer. Everybody's going to be for this bill. Even if you don't agree with politically the person that represents you, it doesn't matter. This is about a child's life. Explain the connection, explains exactly how long you have to do this once someone has passed out from having a low glucose episode. There is no time to wait for an ambulance, just like EpiPens. Luckily for us, the Epi people really have done the groundwork for this. Like Doug said earlier, once you explain to them that this is just like an EpiPen, except it brings our glucose levels up so we can regain consciousness and possibly, save our lives. I mean, it's a no-brainer. If that meeting doesn't go well, or you don't feel like you've made steps where you need to, my next suggestion would be look up in your state assembly. You simply type in your state assembly, the word assembly, legislators, find the chairman of Human and Health Services on both sides, the legislators and the representatives and the senators, and meet with both of them. They possibly might take up the bill if your local state legislator or your local state senator won't take up the bill.
What you do, you need to build allies, okay? And this can be done before and after, but one of the main allies you want to reach out to is the school nurses. And I guarantee you there in every state, there's a school nurse association because they're going to be the ones most likely to give it. And after that, if it's not going to be a school nurse, it's likely going to be someone, a teacher or some other administrator who's been trained to provide this because they're trained. Every state is required to have a state diabetes program in their public schools. You already have this infrastructure in place. And this is just another part of it as it relates to a diabetes management program. So then it's going to be teachers. And so we talked to both. So we talked to the School Nurse Association. We talked to the 2 teacher associations in Georgia. Every state has several. We talked to then the School Superintendent Association. And then we talked to the School Board Association. You kind of see, anyone who is related from teachers to administrators to school nurses who may be involved in this, you want to reach out to them as groups and associations to, one, ask for their support, but to really educate them too.
Because Doug and I in the state of Georgia, we also have an organization that we do Type 1 Day down at the state capitol.
Yeah.
I think I've done a podcast with you regarding that. So we're a little different in the sense of our legislators have a little more training of what Type 1 is. But I would also suggest don't be shy and letting a state senator and a state representative introduce a bill in both chambers, even though it's the same bill. The reason why is sometimes things just get hanged up in committees and stuff. And one of these bills has to cross over on what's called crossover day. It's the halfway point between the session and the beginning of the session, the end of the session, for a bill to survive the first year. So if you are unsure if you've got the right connections going, it's certainly wise to go ahead and drop basically the same bill. They'll just be labeled different. One will be a House bill, and then there'll be a number, and then the other one will be a Senate bill, and there'll be a number. So like ours is HB 440. It's possible if we had one in the state Senate, it could be a completely different number, but it would be labeled as SB and then 320 if that was the number assigned to it. Once I had established that, our next step with, as Doug said, was, finding the common ground with different organizations that deal with this and that will endorse your bill. We also not only talked to the Nurses Association, I also talked to the Medical Association of Endocrinologists. We ended up not using that sponsorship because they're such a small group. They don't even have a lobbyist down at the state capitol. It's just a group to make sure they didn't object to it. Doug and I make it sound simple, but that's because we live it every day.
I did want to ask, in North Carolina, we have a standing order for emergency use glucagon, which is it's not for the schools, it's for individuals, right? So what that means as you listen is you can go to the pharmacy and say, I need glucagon. And it's basically, I don't know if this is the best way to describe it. I feel like a standing order is like a prescription the pharmacist can give you. It's how we get vaccines, right? You don't need a prescription for a vaccine.
Yeah.
You go to the pharmacist, they give you a vaccine. This is different from a standing order, right? This is not a standing order for schools, or is it?
No, what this is, and that's a good question, is that something that was, every state's different on the regulatory, how they do things. So you may have a state agency who has the power to issue a standing order, what you just described, because they regulate prescriptions and things like that. And if that is the case, and I don't know what the case is in North Carolina, but if that's the case where you have a agency of government who has issued this, that also means it could be changed by that agency at some later date by the snap of a finger. What this is actual state code. This is state law. It is there. It would require the whole General Assembly to change it if they wanted to in the future. And so to me, not saying that you should try a standing order, but I think the best way to do anything is to put it actually in your state's code.
And as I said, it's different in that it's not really going to help. If the school nurse needs glucagon, she can't run down to the pharmacy and ask to get it and then bring it back. I don't want to confuse anybody. I just wanted to ask about that.
And one thing I want to clarify too is it related to getting support to get this through? The one thing at this time, we did not mandate this, meaning we did not mandate that schools had to stock undesignated glucagon. Because, these cost around $200 to $300. And particularly for rural school systems, if they're having to stock a couple of glucagon pens and they expire every 2 years, $2,000, $6,000, $7,000, $1,000, let's say, that's a lot of money for these school systems. So one of the reasons that we had the support of the school boards and the superintendents was we weren't coming in and saying, you will do this and you will stock this and you will pay for it.
Yeah.
And so that's one thing too. Now, what we do plan to do is, as we work with the manufacturers, kind of like the EpiPen folks, the manufacturers have done over time, is that they've created the EpiPen have created specifically a pen that is geared toward the public schools that at a discounted rate. And that's what we're looking at, working with the glucagon manufacturers, the ready to use auto injectors and things like that, to where they're going to, if enough states pass this, then it becomes a big enough market that they can say, okay, we can manufacture, in a sense, a kit specifically at a reduced cost for public schools and private schools.
Another thing is that this also would allow parents, let's say you've got 4 type 1s in the school together, y'all could get together and say, hey, I'll get the 2 undesignated glucagons this year, and the next year the other 2 get it. And then if anybody uses it, they're the ones that replace it.
Yeah. No, that's exactly what I was thinking, right? Share those supplies.
Well,
And because
Oh,
they expire. And I mean, how many times have you used one, Stacey?
never, knock on wood. I didn't even want to bring it up.
But did you buy one every year for your school system and every year for your home use and carry
Yes,
around back?
ma'am.
Yeah, and it adds up. I mean,
Yeah.
if this allows parents of those with type 1 to get together and say, okay, who's getting the glucagon this year, that's a little bit of savings for those parents too.
And to that point, the way our legislation is written, it allows entities to contribute. They can either pay for it or contribute to the school system. So the school system can have other people, in a sense, cover the cost of this. And so we give the flexibility for those school systems also from a financial standpoint to allow someone else to donate or pay for however terminology you want to use these things. Also, with all due respect to families who, not all families can afford to have 2 glucagon pens. If you have one and maybe you've given it to your child or something, or if you try to keep it at home because you're afraid your child's going to lose that, this becomes a critical issue, particularly for students whose families don't have the means to go stock, one at school for the kid and one at home for the kid or on the kid.
Sure.
And that's another issue that I don't think a lot of people fully understood, that, this also will help students, obviously, who, families who can't afford to be stocking glucagon at the school.
I know you have a lot on your legislative plate that is not diabetes related, but is there anything else that you'd like to get done T1D related, Doug?
Well, funny you should ask. Georgia, right now, we have a piece of legislation. We're in a 2-year cycle, meaning it still can pass this coming year. We are not so much, it does have an effect with T1 and also T2. So it's type 1 and type 2, which is under our Medicaid rules in Georgia, allowing us to pay for CGMs under Medicaid.
That's not currently allowed.
It's no, Georgia currently under law does not pay for that. Some states do, some states don't. Again, Medicaid is a shared program between the federal government and the states. And the states put in about 40%, the feds put in about 60%. But the states have a lot of say in how that money is spent to a degree. So that is one thing in Georgia that we have not done. And that's something, working with other members of the legislature, that we got passed out of the House. There was a Senate version too that came out of the Senate. So both chambers have passed the basically same bill to each side, but they're being held up. Mainly it has to do with economics. We're seeing this is going to cost the state $90 million a year to provide this to those on Medicaid. But I think the state, we will eventually get it passed. But the way to look at this, and this is something I think it doesn't matter what state you're in, it's a lot of prevention and also how to manage a chronic disease in a way that is, one, beneficial to the patient. And in a sense, I hate to use the word, it kind of forces people to manage their situation, because you would need to go see a doctor twice a year on this. And the reason we, the state, are interested in this is that it will save the state money in the long term.
Well, we'll definitely check in on that. But before I let you go, Trip, let me just ask you, how are you doing?
I'm doing great. No
Tell
worries.
For people in my audience who don't know you too well, but just refresh us with your type 1 story and how, how long you've lived with type 1 and all that fun stuff.
I was diagnosed, actually, I was told it was gestational diabetes. And of course, after 9 months delivering baby, they expected it to, quote unquote, go away. And they lied to me. It didn't go away. I really do think I probably was in the beginning stages of type 1 before I got pregnant. I had lost about 15 pounds right before I found out I was pregnant. I also had morning sickness all 9 months. I mean, I struggled to gain weight during the whole pregnancy because of, the morning sickness. That's where I started. At first they thought it was type 2. It wasn't until I went back into DKA that they realized it wasn't type 2, which made more sense to me. I was real tiny at the time. And that was 1991, 92. I got pregnant in November of 91. So that's my story. After Doug got out of political office, the first time around, I kind of found the internet, kind of found the diabetes online community. And from there, I realized that I had a great tie-in for advocacy, especially in my state. It wasn't that long after that I started Type 1 Day down at our state capitol, which is where I really think I got known. I bring in 20 high school kids that have Type 1 and let them serve as pages. Pages are people who deliver notes back and forth to the legislators on the floor from people out in the hallway. Sometimes they deliver papers to every single desk by other staff members of other legislators. And then I hold a luncheon that day when they break for lunch and invite the health committees from both houses in to meet our kids and often do some type of little demonstration. Lately, my demonstration has been a friend of mine, a retired police officer friend of mine, gave me drunk goggles.
Ah.
And I let the kids pick out which drunk goggles best stimulate a low for them, and then put it on the parents and like throw them a ball and have them touch the ball. Kind of stimulate, what one sensory part of a low is like, with, of course, reminding them there's other things that are going on, not just what you're feeling right then. And then sometimes I'll throw them a juice box and ask them to open the juice box, because we know how those dang little straws juice boxes are and what it's like to try to be able to open a juice box with those drunk goggles on. So
that's
I've
wild.
been doing that in the state for a while, on and off at different places.
Well, as I always say, Della was diagnosed at the end of the Stone Age of diabetes, because when she was diagnosed, you were still using pH sticks to determine your glucose levels.
Yeah,
there were no meters yet.
Wow.
My endocrinologist was able to get a glucagon meter. It was one of the first ones on the market when I was pregnant. Well, I think I was 6 months pregnant by that time when that came out.
Yes.
I was just on the cusp of everything.
It's amazing that it was, you said it was like 1991, 92 that they were giving people home glucometers. I always forget that. That's wild.
Yeah. And then, it wasn't that long afterwards. What was it? 12 years, 15 years later, the Dexcom 6 finally came out. And the egg, I don't know if you remember the egg. I used the egg for a short amount of time.
I think that was 2007 though.
Yeah. That was somewhere in there.
Yeah. Yeah. That's wild. Yeah. We thought Lantus was really an amazing development, right? Before Benny was diagnosed, Lantus came out and that changed. We didn't even know because we weren't in the world yet, but our doctor said, oh my gosh, you're so lucky, 2 months earlier. And he would have been on NPH and regular and eating on a schedule. And I was like, oh my gosh, I'm so lucky. The high tech.
The eating on the clock was probably, I didn't like it because of our Doug and I schedulers is so weird. Sometimes we don't eat lunch till 4:30 in the afternoon. It drove me bananas. So
yeah. Well, like I said, Della, it's amazing how you did things, and you wonder, I hate to say it this way, but you kind of wonder, you're not surprised why people didn't have a long life.
Oh, no, it's totally different management. It's so tough. It's tough now.
That's my worst phrase ever. I'll hear someone say, my so-and-so had diabetes, but they didn't take care of themselves. Oh. And I just want to strangle them and go, are you kidding me? How could they?
Yeah.
It was the treatment that wasn't working. It wasn't them. It was the way the treatment and how difficult it was to treat it. That's another whole.
Yeah, it's another
podcast.
Okay. Yeah. Well, thank you so much for coming on and explaining all of this. It'll be really interesting to see if, as you listen, if you want more information, we'll link it up. If you want to contact your local reps, that would be amazing. I'm happy to provide more information about that. But Doug and Trip, thank you so much for coming on and sharing this. And thanks for doing it in the first place, Doug.
I'm glad to do it. I'm very happy, and I hope more people, the example we set here, they just follow that and take it to their local communities, local states.
Thank you for having us, Stacey. I feel like the more states that can get this passed, the safer our kids will be in school.
You're listening to Diabetes Connections with Stacey Sims.
Much more information at diabetes-connections.com. Just go to this episode's homepage. We mentioned a few websites, and I want to make sure you get the links there in terms of how to make this happen in your state, easy ways to find your representatives. And Doug gave me his contact information, so I will put that in there as well. Up next, I want to talk a little bit about what the first couple of weeks have been like away at school for Benny. You all had an amazing response to the episode about our prep and planning and sending him to college. So thank you so much for that. I've even had future guests, I'm taping episodes in advance, and they've referenced back to Benny. Oh my goodness. So I appreciate that. As you can imagine, we've already had some adventures. That's next. Like most of you, we don't love worrying about insurance. So I'm thrilled to tell you that Dexcom CGM is covered as a medical benefit for 98% of commercial insurance plan holders who have type 1 diabetes. And more plans cover CGM for people with type 2 who use insulin. We even have it as a pharmacy benefit, so I can process it at the local pharmacy, and then they put it on auto refill for me, which just makes it so easy. One less thing to think about. It's worth checking to see if that's available to you. Dexcom will even help you do a benefits check to see what your insurance covers. It's easy and right on the website. Dexcom is the #1 covered CGM brand. Learn more, go to diabetes-connections.com and click on the Dexcom logo. Before I jump in with this Benny story, I want to let you know that this Thursday evening, September 14th, I'm going to be going live on Instagram with Diabetech with Justin. He was on my show a couple of weeks ago. I was on his show a couple of weeks ago. I love what he's doing. He's one of the newer, I guess, influencers. I hate to call it that. He's one of the newer folks in our community who's sharing information. He lives with type 1. I'm excited to do an Instagram live. It's been a long time since I have done one. That is this Thursday in the evening. I'll be posting about it on social media, and I'll put it in the Facebook group. I'm also with the Diabetes Link, used to be called the College Diabetes Network, and that is on Wednesday, September 20th. They're doing one of their Off to College series. So it's me and Anna Sabino, who's a fantastic diabetes educator, and that'll be a lot of fun. All of that information should be in the newsletter that went out today. If you don't get the newsletter, you should get the newsletter. Go to diabetes-connections.com, scroll down. It's really easy to sign up. There's usually a pop-up happening on the website too, where you can just sign up for the newsletter. I don't spam you, I promise, but it's a great way to keep in touch that doesn't involve social media. All right, so let me tell you about what's up with Benny. Diabetes-wise, he says he's fine. I'm not following anymore, so I'm taking him at his word. He sounds great. He looks good. I'm sure he's higher than I would like him to be. I'm sure he did not miraculously start pre-bolusing for every meal and changing his infusion set exactly on time every 3 days. But I really do have faith that he's taking care of himself and doing what he needs to do to stay safe. So unfortunately, I don't have an in-detail diabetes update for you. But if you know us, you weren't expecting that. I can tell you that, oh my gosh, the air conditioning in his dorm stopped working. And I'm proud of him. We're really trying to be parents who don't jump in. He knows this. He wants to handle things himself. So he put in a work order. Everybody in his floor put in a work order, and they came out and they worked at it. But then some students started getting portable air conditioning units. I didn't know any of this until later. So Benny had requested one and was denied. Oh my goodness. So he called me, texted me. He doesn't call me. He texted me and was telling me this whole story. And I said, well, why were you rejected? And he said he didn't know. And I said, I think it's time for me to get involved. And he said, yes, please, which is all I need to hear. So I went to the head of housing. I found her on the website. That was pretty easy. And I wrote what I think is a nice email. Hopefully it wasn't a mean parent email. And basically said, hey, we're confused. We saw that other students were getting these air conditioning units and my son was denied one. Can you please help? And then I said, and this was a little snarky, but I said, I expect a prorated bill for my student's housing because, he didn't have any air conditioning for a week. And, you should take that off the bill. And of course, she wrote back, we're not taking it off the bill. That's, part of the contract you sign is that maintenance stuff can happen. But she also was very responsive. I think she emailed me back 15 minutes later saying, we're going to take care of this. What's your student's name? What dorm? All students who request a portable unit should have one. That was great. So by that evening, he had one. Now, if you're thinking like me that they're schlepping window air conditioning units, right? These big industrial things, and you're thinking, how can they give everybody in the dorm one of these? First of all, it's a much smaller dorm than you may be envisioning. I lived in a high rise when I went to Syracuse University a million years ago. I think I was on like the 11th floor. Lots and lots of kids. This is a 3-story, maybe 10 rooms per floor, maybe 20. I'm thinking there's like 2 buildings attached together pretty much. And they gave him, he says it works great, so no shade. They gave him this thing and I'll post it in the Facebook group. It's like a bucket with a hose. And I guess the hose attaches to outside or to the vent, to the unit. I don't know how anything works. I apologize. And he said it cooled the room amazingly well. So there you go. Now, I did tell him that if he had called the Office of Disability the first day the air conditioning went out, he would not have had to wait. And he acknowledged that that was probably the case. But he didn't do it then, and he didn't do it now. And so, hey, that is up to him. He just needs to know the option is there. The option is valid, and he could have used it. So not surprised, but I bet next time something like this happens, he may, because let's face it, I mean, that's not a perk for type 1 diabetes. That's a legitimate need. I did ask him if his blood sugar was going bananas because of the heat, and he said, no, he was fine. He always tells me, no, I'm fine. Oh, that kid. I'll be telling this and other stories when I join the diabetes link on the 20th. So please look for that information. All right. Thanks as always to my editor, John Buchanan from Audio Editing Solutions. Thank you so much for listening. I'm Stacey Sims. I'll see you back here soon. Until then, be kind to yourself.
Diabetes Connections is a production of Stacey Sims Media. All rights reserved, all wrongs avenged.